I see patients with a defect in their knee. I'm a knee surgeon, and it's very clear that you use your joints so much that when they don't work well, it's a severe limitation on quality of life. And one of the biggest drivers and one of the biggest motivators is we get to improve quality of life by not just taking care of people, but also doing the research to take better care of people. And I think we're in an advantage at Mayo Clinic because we see a lot of patients, and we have done so for many, many years, and we've documented well how they do. And that gives you the confidence and it gives you the scientific know-how to be able to advise people. In medical school, through the ages, we've always been taught if cartilage is gone, it doesn't come back. Well, that's not true anymore. We and others have developed treatments by which we can grow cartilage again. And we now know that if you have a defect in your cartilage, you can treat this like a pothole in the road. You can fix the pothole. Doesn't mean it's a normal road again, but it's better driving. And the same with the knee. We can now fix defects in the knee, so it's not a given that a defect in the knee is arthritis. A defect in the knee is an option for regenerative medicine. That's one of the strengths here at Mayo Clinic, to provide patients with a pause button so they can go on with their life without their joint going downhill. And now we know that if you tear your ACL, if you tear your meniscus, if you damage your cartilage, there are solutions for that. We've developed cell-based technologies, we've developed suture technologies, we've developed reconstructive technologies that allow us to say we are good at joint preservation, not just joint replacement. MACI is a cell-based therapy. You take a person's cartilage, you send it to the lab to be cultured, and after a few weeks, they give you a resorbable sponge biomembrane with the patient's own cells in it, and those cells are able to restore cartilage, which before was impossible. We get to put that back into the defect, the cartilage cells grow new cartilage, and the patient can use their joint better than before. The reclaim procedure is really interesting because even though cartilage is damaged and cartilage doesn't regrow itself, it doesn't mean that the cartilage cells aren't healthy and they don't want to make cartilage, they just don't know how. So the basic science was, let's say the cartilage cells are okay, but they don't know how to make cartilage. How can we instruct them to make cartilage again? And then we said, well, let's put them together with MSCs. So the medicinal signaling cells are able to instruct the cartilage cells how to make cartilage again, and they're able to clean the joint environment to make sure that this is an environment where the cartilage will grow better. Before it was 3 to 4 weeks, sometimes even months between two surgeries in which a patient's life's on hold. And now we can do so in one surgical procedure in daycare, and they're on their way to rehabilitation and improvement. And the results are the same and sometimes even better than the current technique. It's a nice example of how we try to push the boundaries and make the care for the patient slightly better every time. Mayo has a long-standing reputation of coming up with new solutions to problems that weren't solvable before. And I think that provides them with an opportunity to at least come to talk to us about what can we do for you and how can we work together to provide you with a solution that fits your needs. And that's unique to Mayo, and that instills confidence.